Earlier you heard, really, I think from Patricia and others, about how to care for the elderly. Now we're at a point we have telemedicine, remote monitoring, right? Perhaps even robotics.
Sure.
I know you've been thinking a lot about this area. I kind of said, design a home for the elderly for the future, right? Talk to us a little bit about your perspective.
You know, first off, it's an honor to be here, so thank you. You know, I believe that innovation, since that's our topic and what the future is, really begins with a, shall we say, a story, a vision, and a lot of faith, and then the science follows. And I want to start with that idea of where technology is going with a woman who inspired me, an older woman that I never got to meet, Sarah Noss. She lived, many of you may recall the name, 119 years old. In Pennsylvania. I grew up in Philadelphia as well, so I, like her, presumably believe that scrapple, cheesesteaks, and tasty cakes are food groups. Perhaps she did better. She will do better than I will. But she was asked, why do you enjoy living so long? And this was on her 119th birthday, which, you know, takes a lot of chutzpah to ask a woman that age on her birthday why she enjoyed living so long. And she came back with an answer far better than any of us, any policymaker, any researcher. She said, I enjoy living long because I have my health and I can do things. Ladies and gentlemen, one of the things I want you to think about is how can we use technology not just to address this thing we're calling today aging? What is aging? It's life tomorrow. I want to invite you, I want to challenge all of you to use technology not just to create a smart house so that we can take care of your chronic conditions, but I need you to create a new story. After age 67, we run out of narrative. There's no great story. We just have this aging thing, how we're going to manage our old age. And if you think about it, if you look at the data so far, the last 10 or 20 years, we're using that longevity dividend not to do more different and exciting. The kids are taking longer to go to college. We're taking longer in the things we're already doing. So I wanted you to think about this. Let's use technology to rethink education. Do any of us in this fine hall believe that our education that we got from 0 to 20-something is going to last us for a lifetime? How will augmented reality, virtual reality, MOOCs even, help us to keep learning to stay and work longer, to be productive, but also to be worth talking to later in life? You know, the use it or lose it as well. We talked about in a few other panels the idea of working longer, not just to, shall we say, save our financial behind, so to speak, but we also have to start rethinking about re-engineering the workplace so that the lighting works for eyes over age 40, so that we can think about the ergonomics of the workplace. How do we use technology to manage not older and younger workers, but a workplace of 3, 4, 5 generations of work, and we haven't even begun to think about that. How about community? I love the discussion we had earlier about brain plasticity. It seems that our brains are changing, but society is not. We talk about communities that are age-friendly as if it's a nice thing to do. Is your community age-ready? Where's the transportation to get you to all those big and little things that we call life? Is the autonomous vehicle going to be here in time for the rest of us? Is Uber or Lyft going to be that little thing that keeps us moving to go to the things that we love, like ice cream cones, not just policy discussions about, gee, can I get you to the doctor's office?
All right.
Health. What about health? We need new measures. Sarah Noss and a number of us spoke about it earlier. You know, we're hung up on all these great variables that we collect as scientists and researchers about what we think health is. But we have yet to define any serious quality of life measures that our patients and our clients and subjects can actually understand to motivate them to do the things that they should do to live longer, better. And I do have to say at the end of the day, I hope I can get away with this, I want to bring up the F word, that is fun. There is no discussion on how to use technology, how to use that longer life into doing things that are fun, whether it is about new relationships, whether it's new sports, new activities, learning new things. Ladies and gentlemen, we are treating the greatest success of humankind as if it's a problem. We just gave you 30 or 40 years of life, and we're just taking longer doing the same stuff we've done before. So here are 4 leverage points I want you to think about where we can use technology. But it's more than technology. You know, technology is a toolbox. You need an architecture imagination to say, this is the house I want to build. So yes, Technology is going to be a big part. But please, even my own students, there's got to be more to technology than another pill reminder. How many of us are going to have many things glowing in our house to tell us to take our beta blockers? Autonomous cars may be a future, but the public policy is taking a long time. The Internet of Things is really cool. We're going to have toilets talking to our toasters about whether or not we ate and whether we ate enough or not. But how does that fit into the life that you want to lead? Solutions are not about one widget at a time, but a vision of how we wish to live tomorrow. Public institutions, here we are in Washington, D.C. There is not one single agency that owns aging. We've got some research over here, we've got institutions over here that are about programs, but we've got the Department of Labor that owns labor, we've got Department of Transportation that owns transportation, and yet the single most defining moment of demographic human history, there's not a single agency. There's not a head, there's not a czar, there's nothing. And yet, it's the biggest thing that we have going, at least for those of us in this room. The older woman, if I may be so bold to say, that asked a question of a previous panel, it was 93. I agree with her. You cannot turn the wheels of innovation in a society without individual behavior, individual motivation. So yes, I can provide technology that will make things beep in the night to make sure you do the things you want. Institutions may help with funding and vision and keeping things on the agenda. But at the end of the day, individuals and families are the motivators that manage, monitor, and motivate our well-being. And then lastly, business can't get off the hook here. This is the largest case for a public-private partnership. I know that's old rhetoric from many decades ago, but aging is too big an issue for just government. It is too big for just business. It is too big for any one individual or family. We need to have business at the table because guess what? All the research in the world coming from the gentlemen around me and the ladies and gentlemen in the audience can't get to where I need it unless business puts it out there. When America has a problem, I know you're going to laugh or give me a hard time, America goes to the mall. And today there is no single technology, service, or system that I can get off the shelf. I have to beg for either a really kind-hearted doctor who's got time or a discharge nurse who knows. And frankly, if we think about the workforce, these new technologies, these new things that we're thinking about with an aging society, we don't have the workforce that's trained for that. So let me end, because my time is up, which I guess at an aging conference has dual meaning.
I'm sticking.
You know, I'm fond of art history, and there was studies done many years ago about why the Europeans built cathedrals in the 1200s, 1300s, 1400s, when really they didn't have the people to justify the crowds that could fit in these grand halls. They did it because they wanted to see how far could they push their vision, their math, their architecture, their engineering, their vision of tomorrow. Ladies and gentlemen, aging is not a problem. It is a cathedral to be built. And I hope you all join all of us together in a partnership, not just to live longer, but to live better.
Thank you, Joe.